The acute medical and assessment unit really will take patients that would have gone previously to ED, have been seen by the general practitioner, sent in, so they won't be through a medical emergency. They will have already been seen, but they have a condition that needs to be looked at. They'll come in here for assessment, some early diagnostics. Doctors will see them, make a decision about whether they need to be admitted overnight and they'll stay in this ward, or for a longer term and they'll go to an inpatient facility. But each of the rooms, the assessment room, have got full diagnostic facilities in there, so the doctors will be able to make good, fairly rapid access to diagnostics and treatment decisions. The other thing that we did was we realised that we've got an obesity epidemic really, and we've got a growing problem with a large number of patients whose weight exceeds 250, 280 kilos. And so in each of the wards there are what we've called bariatric facilities, which are single bedrooms that have the capacity to nurse these bariatric patients and transfer them safely from bed to chair.
Once the patient is up in the sling, you would position the hoist in the rail so that it locks in place over by the ensuite. Hit the button here that opens the gates, and now you're able to move the motor and the patient all the way through very easily into the ensuite. Once in the ensuite, you can close the gates. And once again, you're able to move the rail backwards and forwards. So you could move the patient all the way to the shower and lower them into a shower chair in the showering area.
So we're in a negative pressure isolation room, and what makes this room very unique is that if someone has a respiratory bacteria or respiratory virus that's actually easily transmitted through the air, the patient can be in this particular room. The room is designed so that the air goes out through the ceiling and in through filters, and so it never has to go back out into the corridor. The big advantage is if you've got someone with a disease such as tuberculosis, which is spread by respiratory through the air, then that particular bacteria will not ever transmit out into the other area.
As part of the review process, we took the opportunity to look at the facilities we had now and what they should look like into the future. And we were very aware that we actually had a very small amount of single rooms, a lot of double multi-bedded rooms that probably for a modern facility weren't necessarily conducive to a good therapeutic environment, good patient environment. So we took the opportunity to substantially increase the number of single rooms that we have, and this facility has around 65% of the rooms in total as single bedrooms. The facilities have ensuite bathrooms in each bedroom, and in the 4-bedded wards they've got 2 bathrooms as well. So we've increased the number of bathroom facilities, we've increased the number of single rooms, we've increased the size of the corridors so that 2 large beds, the bariatric beds, can be accommodated to pass around in the ward area. This facility is fairly unique, and what we've looked to do is obviously future-proof ourselves now, but also use it as the concept in terms of going forward. And you'll be aware that we have to, at some stage, redevelop the rest of the campus. So we've got quite old ward stock, as we call it, here, on certainly on the Waikato facility. And so this will form a benchmark for us, really, to move forward from. And we would expect that facilities in the future will have a high number of single rooms, ensuite bathrooms. The type of facilities we've built, we believe, are the blueprint for the future.